When I was younger, I was really sick and I was in and out of the hospital a few times. And that's when I really started to notice how I gravitated towards the nurses and how they were there to care for me.
It was my friends who prodded me to go to nursing in college. But once I'm a nurse already, it was just like a good feeling to help take care of others.
I like to do the nursing. I like to care a lot. I love mother and baby. They go home very happy.
I'm a new graduate nurse, and my first job was working in the operating room here at NYP Lower Manhattan, and I've had nothing but a huge amount of support from my managers as well as my peers, and I also could say only great things about the culture that we uphold here and really focus on the patient.
I think it's the reinforcement that we get, that they listen to us and that they're giving us the tools that we need to make that care better. So they came down, they spoke to us, we told them what we needed, and they gave us those tools. So what else can we do except shine?
With NYP now, we just feel proud that we're under one big umbrella.
We had a lot of support from the NYP and management, and then we get a lot new equipment, and then we're happy about it.
And that's what's going to make you work even harder, because now you have everything that you need to provide the best type of care for the people that are coming to see you.
I have to live up to that award that they gave me, so now I have to pursue more challenges, like probably doing my certification now, so that I will be in that certain level that they expect me to be.
Now I'm second time get the award and third time nominee.
It comes almost naturally to be able to place yourself in the patient's shoes or the family member's shoes. Being around them so often really makes you aware of how important it is to understand what they're going through.
If you don't have that, that communication, or to feel that empathy with them, because I could only imagine what it would be like from the other side. So I would try to put myself in that situation, so that way I'm like, okay, so how do I want somebody speaking to me?
In the operating room, you work very closely with the patient as well as the family members, and it's an especially nervous time for them. So I really find that explaining to them, exactly what to expect, what the room might look like, it might feel cold, even small features such as that help them feel a little more reassured.
Because the patients are critically ill, it's important to keep the families updated. Because if I were that in their shoes, I would also want that kind of inclusion within that care.
So everybody gets treated like grandma when they come in, So that's how I always see it. Like, if my grandma came in here, how would I want her to be treated? I had a patient that it wasn't even my patient, but she wasn't able to communicate. But she kept I think she was telling what a piece she needed to be changed. So I started speaking to her, very nicely, very quietly. I said, you're gonna go home, and can you move? And she moved, and I changed her, and I said, everything's gonna be okay. And she couldn't say a word, and she just kissed my hand, and like the tear went down. I was like, oh, okay, I did something for her, which was really nice.
I support. I ask them nurse what you need, and then what they asking, I do right away. They like me what I do.
And for me, working in the operating room, I definitely feel as if it could be stressful and crazy, but by the end of the day, you really feel leaving like you made a difference, a sense of satisfaction, and just being very happy to be part of the family that they've created here.
I take every day like a challenge, and it's a new day.
And just making that little difference, just a smile on somebody's face, just means like it just speaks worlds.